Good afternoon. Today is Thursday, February 19th. It's my husband's birthday. Happy birthday, Len. And we are going to hear, I think, 9 bills today. I'm going to read the bill order, starting with Senate Bill 582. And Senator Jennings, Rachel's here. You want to come up to the table, Rachel? And then we'll go to Senate Bill 485, 528, 413, 563, 564, 569, 438, and 439. So thank you very much. And the sponsor, for you, Rachel, you're the sponsor. The sponsor has as much time as they need. Everyone else gets 2 minutes, and I will enforce it. Thank you.
Great. Good afternoon, Chair and members of the Finance Committee. My name is Rachel Allman, Legislative Director for Senator J.B. Jennings. I'm presenting Senate Bill 582, Consumer Protection Unsolicited Loans, on his behalf. Senate Bill 582 prevents the mailing of live checks or negotiable instruments that automatically create a purchase or loan obligation when deposited. This practice primarily targets homeowners, particularly elderly and low-income individuals, for predatory home buying schemes or high-risk credit products. This bill does 3 things. 1, it prohibits sending unsolicited live checks through the mail that can trigger legal or financial obligations. 2, it preserves the ability for investors or lenders to send letters or solicitations that do not include negotiable instruments. And 3, establishes enforcement mechanisms, including fines and criminal penalties, to deter predatory practices. Unlike standard advertisements or loan offers, these checks automatically create a binding contract or loan upon deposit. In the context of home purchases, depositing the check constitutes acceptance of an offer that can require a homeowner to vacate their property. For credit offers, the check triggers high-interest debt without informed consent. We believe that unsolicited checks are not mere marketing, and I am holding a copy of one of these checks sent to us by a constituent offering to buy her home well below market value, a live check in the amount of $234,368. Wow. She has claimed to receive these checks weekly during prime real estate season and is concerned someone will snatch it from her mailbox and commit identity theft and potentially sell her home without her knowledge. Predatory investors and lenders often target vulnerable seniors, low-income households, and those with limited financial literacy. They create confusion, pressure, and the risk of accidental indebtedness or property loss. Vulnerable populations, particularly seniors, experience disproportionately high losses and underreport fraud due to fear or confusion. Current consumer protection laws prohibit deceptive practices, but no law prevents the mailing of negotiable instruments that automatically creates debt or contractual obligations. SB 582 closes this loophole, providing a clear, enforceable rule. The bill does not restrict legitimate marketing, pre-approved offers, online applications, or other traditional credit products. Borrowers retain access to emergency loans, credit unions, banks, and online services. The bill targets only unsolicited instruments that create obligations without explicit consumer consent. The bill establishes fines and misdemeanor penalties, creating deterrence. And we want to thank the Office of the Attorney General for his support, and we are open to the amendments that are offered by the Maryland Bankers Association. And with that, I respectfully urge the committee to give SB 582 a favorable report.
Thank you, Rachel. You did a very good job.
Thanks.
I'll let your senator know. You probably did a better job than he would have done.
Oh, I'm going to tell him that later. This was my test run.
Do you have, Senator Kramer has a question for you.
Thank you, Madam Chair. Quick question about the wording of the bill. The example that you just showed us, that check was for the purchase of the individual's residence, but the language in the bill says the check or other negotiable instrument is sent in connection with an offer to extend credit to the individual. In this case, am I mistaken? It's not really an offer to extend credit. It's an offer to, we will pay this for your house. I'm assuming, you go and deposit that check, then they're going to come and make claim for the ownership of the residence. So it seems like maybe there's a distinction, and I don't see where else it may be covered in the language of the bill to address the circumstance that you've just identified with that
I
check.
agree, Senator. So we've had a lot of conversations with the Bankers Association and others. I spoke with the Office of Financial Regulation yesterday because I do agree we need to update and amend the language, and I'm hopeful that working with the Bankers Association, we will really address this specific instance that our constituent brought to us, but it seems to be a bigger concern than just this purchasing of homes, as the Attorney General's letter seems to indicate. So we agree that we want to include stronger language
So
to address that.
you're on it.
Yes, working on it.
Okay,
Yes.
all right, thank you.
Thank you.
Thank you. I don't see any other questions. Thank you very much. We do have Evan here from the Bankers Association, and you are favorable with amendment. Oh, wait a minute. Hold on a minute. Is Jennifer Bevan Dangle here? Jennifer's up first, favorable. Thank you, Jennifer.
Good afternoon, Madam Chair, members of the committee. My name is Jennifer Bevan Dangle. I'm the Deputy Director of Economic Action Maryland Fund. We're here in strong support of this legislation. We could tell you stories from our clients who receive these instruments in the mail and do not understand them. We have a direct service program that works with older adults. They will call our service providers and sort of be frantic. But actually, on a personal level, I've had this incident with my own mother who received one of these checks for the purchase of her home. She did not understand why she got it. She did not understand what was happening. She thought someone had already purchased it. I mean, the sort of horror and panic that is elicited when people receive these cannot be understated. And even myself, as a consumer advocate, I've received these blank checks in the mail around Christmas, and I almost used one thinking that it was just a cash advance on my existing account. And it wasn't until I stopped, took a deep breath, and looked for the fine print that I realized it was a very high interest loan. So these materials are very deceptive. And while we see senior fraud and financial scams against seniors are tremendously on the rise, so that's the population we're most concerned about, anybody can fall victim to these incidents. And we have seen the District of Columbia Attorney General, we've included a link in our testimony, taking a stronger position on these, really trying to warn their constituents. But if the state of Maryland can get ahead of these and just put an end to this practice, we would be very, very grateful. The other piece of this that's incredibly concerning is simply theft out of mailboxes. We know the FBI has put out reports saying that check fraud, check theft, identity theft from stealing documents out of mailboxes is on the rise. And having these be instruments that just need a signature with no verification is definitely exposing our constituents to that identity theft and fraud as well. So very strong support of this bill and very grateful that the senator brought it forward.
I can only imagine what that was like for your mom.
The panic is real.
It really is. Thank you for your testimony, Jennifer. I don't see any questions for you. Now we'll have Evan come up and talk to us about his amendment. Thank you, Evan.
All right, thank you, Madam Chair, members of the committee. For the record, my name is Evan Richards. I'm the head of government community relations for the Maryland Bankers Association. First, I want to thank Rachel for taking the time to chat with me the other day, kind of walk through the concerns that the constituents had. So when I submitted the written amendment, we did talk about convenience checks, which are products that are actually extended to an existing line of credit. So whether or not they would actually qualify under the bill as being prohibited, I think we would appreciate some clarity on that. But the one thing I do want to make clear is that for regulated financial entities, banks, credit unions, finance companies, et cetera, when they do use these live checks, they are accompanied by a loan agreement that clearly and conspicuously lays out the terms of that agreement. So we do understand the concerns. I just wanted to make sure that was clearly stated. But as I've mentioned to Rachel, that when it comes to this particular instance where an offer was made to purchase a home, we're happy to work with her on language that would help address that issue. Thank you.
Senator Kramer.
Thank you. Evan, question, Are there banks in Maryland that are sending these unsolicited checks that, I'm trying to understand the position of the Maryland Bankers Association, because it sounds like you're saying you all are doing this, but you have clear language that accompanies the check. Is that something banks are doing?
Yeah, at one point, they did it pretty frequently. From my understanding, we had a meeting with our membership on Tuesday. We actually had one member bank bring this to our attention, that they still did it.
Seems a little sketchy, doesn't it? You know, when you say, well, we send this check, cash it in, now there's a contractual relationship. And by the way, we sent language, because, you know, I was just thinking, would an alternative to maybe this bill is simply render unenforceable any contract that is a consequence of an unsolicited negotiable instrument, so that you guys want to send me a check for $5,000 for whatever reason, I deposit it, your loss, because it's unenforceable. And I think that would quickly reel in those actors who are doing this, because now they are out whatever monies they're sending, and that would bring this to a halt. But I'm kind of surprised to hear that.
I was surprised to hear it from the member bank myself. So we'd be happy for further conversations on that.
All right, yeah, maybe we should do that, please, because it just seems like a really sketchy practice, and I would have thought that our Maryland banks would be held to a higher standard in that regard. So, all right, good. Yeah, let's. I'll track down Bob Benton.
Okay.
All right, thank you.
I have a question then, Evan. We have Maryland banks, and then we have federal banks that operate in Maryland.
Right.
Could it apply to all those banks, or would it just be the Maryland chartered banks?
Based on my understanding of the bill, it looks like it can apply to everybody.
See any other questions? Thank you for your testimony. That ends the hearing on Senate Bill 582, and now we'll go to Senate Bill 485. If Senator Croza is here, she is. Thank you, Senator Croza. And you're bringing Diane Arias from the Maryland Catholic Conference? And who? Okay, and your virtual panel member, Jonathan Alexandre, is going to be on with us too. Thank you.
Wonderful. Thank you, Madam Chair, and members of the distinguished Senate Finance Committee. It's good to be here. For the record, Senator Mary Beth Carrozza, representing Maryland's coast, and that's Worcester, Wycomico, and Somerset counties. And I really appreciate this opportunity to present Senate Bill 485, which is a women's health care data bill. And Madam Chair, and I know I also worked with Senator Gao last session on this. During the interim, we did a lot of work. You kind of picked up from where we were last year, and so wanted to kind of go through the bill with you. It would require the Maryland Department of Health to collect and compile data annually regarding the cost of prenatal care, birth, postpartum care, pregnancy care, abortion, menopausal care, as well as mental health care related to women's health, to better understand the financial impact of these services on individuals, providers, and the state. This legislation would promote transparency and accountability in women's health care spending while, and I want to be very clear, safeguarding the privacy and dignity of individuals, and we did strengthen those provisions in the bill. Senate Bill 485 would strengthen women's health care reporting and would put Maryland on par with 47 other states which voluntarily report key women's health care data. Over the past decade, rising health care costs have placed increasing pressure on patients, employers, and state budgets. I think we can all acknowledge that. In response, many states have prioritized cost containment strategies to better manage unsustainable growth in healthcare spending. A necessary first step in this effort is identifying the underlying cost drivers. Generating reliable, aggregated spending data allows policymakers to develop informed evidence-based public health decision. I want to be clear, and also wanted to thank Senator Reedy for co-sponsoring this, as well as Senator Jennings, who's not here as well. This legislation does not conflict with existing Maryland law. It is limited to the collection and analysis of cost data for fiscal transparency and public health planning purposes. It does not authorize the disclosure of patient identifiable information or provider-specific clinical records. Maryland Shield laws, chapters 248 and 249, prohibit the disclosure of sensitive reproductive health information, including methylstring data and diagnostic, procedural, or medication codes related to abortion and other reproductive health services by health information exchanges, electronic health networks, or healthcare providers. This bill does not alter or undermine those protections. It focuses solely on aggregated cost analysis and does not involve the release of protected health information. I also want to just, again, putting this in context on the focus of data collection, that we know that chapters 244 and 245 of 2023 established the constitutional right to reproductive freedom in Maryland, was approved by the voters in November of 2024. That remains fully intact. This legislation does not change, limit, or burden that constitutional right. It neither restricts access to services nor alters legal standards. It merely serves as a fiscal and public health transparency measure designed to better understand healthcare expenditures across service categories. And I believe it strikes a balance of providing both transparency and accountability in women's healthcare while protecting that privacy. So I really wanted to hit the privacy issue hard, so everyone was clear on that. I also wanted to point out that this bill helps prioritize women's health in Maryland. The number of women who die giving birth in the United States has nearly doubled in the last 2 decades. And we are the only first world country with a consistently rising maternal mortality rate. As a state with a prominent African American population, we also must consider that African American women are 3 times more likely to die from pregnancy-related complications than white women in the United States. From 2019 through 2023, Maryland had a maternal mortality rate of 21 per 100,000 births across all races and ethnicities. But for African American mothers, the mortality rate was 30 deaths per 100,000 births. Several members of the House Health Committee recently pressed state health officials on the lack of progress in bettering maternal health outcomes for Black women, which continuously falls behind women of other races and ethnicities. With data collection, these disparities can be identified and addressed. Again, the power of data. The legislation before you now, which has been revised from last year, includes a broader range of topics that directly impacts women's health, including menopause, and it is estimated that 40% of women experiencing menopause also experience depression, an alarming statistic compounded by the lack of specialized health care for menopause in Maryland. Again, I'd like to talk about the value of collecting and analyzing data on reproductive health care services would not only help address gaps in support for pregnant women, but also provides a clearer picture how to better serve women in need. I have included a detailed list of the positive impact of this women's healthcare data bill, but I'd like to go through those. 1, informed policy decisions. 2, budget transparency. 3, identifying gaps in healthcare access. Data collection can reveal disparities in healthcare access and affordability, particularly for underserved populations. Support for women and families. Preventive healthcare strategies, we should be talking more about prevention. Cost data can highlight the financial impact of preventable complications, such as untreated postpartum depression or pregnancy-related health issues. This does allow for the development of preventive care programs, which are often more cost-effective and improve long-term health outcomes for women and children, again, tied to the data. Accountability for abortion costs. Collecting data on Medicaid funding used for chemical and surgical abortions ensures accountability and compliance with state and federal regulations. This transparency is critical in understanding the financial and societal impact of such procedures. Again, I want to say this data would be protected by state and federal privacy laws, and this data collection does not restrict access to abortion. We also would be looking at data on the cost of abortion care training programs to help access their financial sustainability and effectiveness. This is necessary to ensure appropriate use of resources and adherence to statutory requirements. Data collection helps identify areas where investments are needed to improve maternal and child health outcomes. For example, understanding the cost of postpartum mental health can lead to targeted funding for mental health resources, which, given our budget challenges, should be especially important in targeting those limited resources. I've also included other benefits of the legislation and the data collection, comparison with national benchmarks, ethical considerations and oversight, and fostering public trust. Access to comprehensive fiscal data is essential for assessing associated health risks and ensuring that adequate support is available for women. It should be noted that the Maryland Department of Health has developed a capability to create specialized public health data by using the state's data utility housed at CRISP, the Chesapeake Region Information System for our patients. It is the state-designated health information exchange by the Maryland Health Care Commission. The data utility has a board created originally by a coalition of hospitals in 2006 with board members from the Maryland's Department of Health, Public Health, and Medicaid. And I know this committee knows this, but the Maryland Department of Health started using CRISP as a public health utility for a platform to support opioid crisis mitigation. And I wanted to point out last year in my testimony, and just bring it again to this year's testimony, former Maryland Health Secretary Dennis Schrader did testify that CRISP can readily support public health data projects cost effectively, which is why we do not accept the Maryland Department of Health's fiscal note of $761,000 cost estimate, which is dramatically higher than the fiscal note, which we also believe is artificially high. I also want to point out that the financial burden to collect this data would be limited as the data already exists in billing systems. And this is some of the points that those that express concerns about it. Providers routinely submit CPT, which are current procedure terminology, HCPCS, Healthcare Common Procedure Coding Systems, and ICD, International Classification of Diseases, these codes to specific services. They're already routinely submitting these. So the U.S. healthcare system already relies on this standardized transaction, again, set under HIPAA administrative simplification rules. My point being that a lot of this material is already, the providers are already routinely submitting this. Cost reporting would not impose new clinical obligations. It would create visibility. Women often face higher out-of-pocket healthcare spending due to reproductive health needs, pregnancy care, and longer life expectancy. By illuminating price variation and patient cost sharing levels, We as policymakers, and I say that collectively, can better identify gaps in access, affordability barriers, and inequities in reimbursement. This bill would enable targeted policy interventions, more equitable reimbursement reform, identification of geographic or demographic disparities, and consumer-facing transparency tools. And I would make the case, all of this information that would be helpful to this committee in making policy decisions. This legislation requires the Maryland Department of Health to collect and compile this data annually, regarding the cost across the board: prenatal care, birth, postpartum care, pregnancy care, abortion, menopausal care, as well as mental health related to women's health. This would lead to informed policy decisions, budget transparency, identifying gaps in healthcare access, preventative healthcare strategies, accountability for abortion costs, evaluation of training programs, and using data to identify strategies to promote maternal and child health. Again, I will repeat, data is power, and we should be using it to promote women's health. And so for all these reasons, I ask for your kind consideration and to work with you in moving forward with this important women's health care data bill, an important bill that would benefit Maryland women and families. And I appreciate, Madam Chair and the members, for allowing me to go through to let you know the significant amount of work that was done to address issues that were raised last year, to really focus on disparities, and to really see how we can use data as a way to inform our decisions, especially addressing those women most in need. With that, I'd like my panel to present before taking questions, if that's okay.
How we do it, thank you. So Diane, you want to go ahead?
Good afternoon, Madam Chair and esteemed members of the committee. My name is Diane Arias, and I am the Associate Director of Respect Life Advocacy for the Maryland Catholic Conference, the public policy voice for the three archdioceses in Maryland, serving over 1 million Catholic Marylanders. We are grateful for Senator Carrozza's leadership and respectfully urge a favorable report on Senate Bill 485. In my written testimony, I provide detailed data on why this legislation would impact Maryland women. And today, I would like to highlight the feasibility of collecting the cost data outlined in this legislation and explain why it matters to Maryland women such as myself. States such as Massachusetts and California have strengthened healthcare reporting requirements to include not only hospital pricing information, but also detailed financial data such as revenues, operating margins, and investment practices. In Connecticut, dashboards developed for the Office of Health Strategy summarize data for the state's all-payer claims database, giving policymakers clear insight into cost drivers and spending trends. Similarly, California established the Office of Healthcare Affordability to collect, analyze, and publicly report total healthcare expenditures to improve transparency and accountability. Maryland should have the same ability to identify what is driving healthcare costs and whether financial burdens are contributing to poor or preventable health outcomes, especially for women of color. A thorough cost analysis can determine whether rising expenditures are driven by pricing, limited access, lack of preventative care, workforce shortages, or increased utilization. Understanding whether challenges stem from provider shortages or service volume or other systematic issues is essential for crafting responsible and effective policy decisions. Understanding the financial impact of these services is critical for evaluating women's healthcare needs and ensuring that resources are allocated effectively and equitably across Maryland. Thank you for your time, and I respectfully urge a favorable report on Senate Bill 485.
Thank you, perfect. Jonathan, can we have your testimony?
Madam Chair, thank you, and members of the committee. I'm grateful to be able to share this testimony with you. My name is Jonathan Alexander. I serve as Legislative Counsel for the Maryland Family Institute, and we are in support of SB 485 for the simple fact that Maryland cannot truly make responsible decisions about women's health funding if it continues to operate in the dark about the basic utilization and cost data. You know, if we don't collect data and report standardized information on the cost of prenatal care, of birth, of postpartum care, of pregnancy care, of abortion, of menopausal care. It becomes impossible to say with confidence whether or not the current appropriations are actually meeting the level of need in our communities, or if they're being used for the purpose that they are set out. 47 other states are operating in an above-the-table manner and allowing citizens to know both the status of private, but most importantly, public funding. And this time last year, Maryland became the first state to tap into the ACA mandating funding that required a pool of money to be allocated exclusively for abortion. And claimants at the time said, well, it's because women in Baltimore really need more abortion funding. And the simple question was asked, well, how many abortions are taking place in Baltimore City? I ask you the deeper question, how many abortions are taking place in majority Black and brown communities? If we're not collecting data, how do we know that we need more funding? So Senate Bill 45 offers a careful, targeted solution that addresses this problem by directing Maryland Department of Health to develop a standard system to compile and to collect annual data costs. We can maintain privacy, we can encourage fiscal transparency, the passage of this law, and so we request a favorable report.
Thank you. I don't have any questions. Oh, Senator Matz.
Does the legislation at all address the availability of care providers? I just know in my district I believe we have 2 OBGYNs serving parts of Queen Anne, Caroline, Talbot, Dorchester counties too. Is that included in the data that's being collected?
So this legislation would simply be a cost analysis. We believe that with the implementation of the legislation, it could lead to understanding that information of providers and if there is a lack of access in certain regions of the state.
I want to underscore that point, which is kind of the importance of the power of data and collection, because that's where we, with that information, can look at the disparities.
Yeah, and I was looking at the testimony, that MedChi is opposed, but there's 47 other states. Is that correct? There's 47 other states that do this.
And I am following up. I was actually surprised myself when I saw the testimony, and I've initiated a conversation and follow up with them.
Thank you.
We're going to do a little research too, Senator. Thank you. Senator Lamb.
Thank you, Madam Chair. I just have a question. I was reading through this bill, and on page 3, it references prescription costs for abortion pills, including costs associated with abortion pill reversals. What's an abortion pill reversal?
I'll be happy to answer that question if the panel allows.
Go ahead, Jonathan.
Dr. Lamb, as you know, the mifepristone pill is designed to stop the production of the hormone progesterone, progesterone being the one hormone that the baby relies on as before the placenta takes over and basically feeds the baby. The progesterone is needed to sustain that baby, and so mifepristone has a targeted approach to stop progesterone. And so the baby basically starves for food and shrivels up, turns gray. A second pill is sent, misoprostol, and that actually expels the baby. So abortion pill reversal is the true time-tested, scientifically accurate way of, in the time period where progesterone is being halted, abortion pill reversal allows progesterone to be placed in a supplemental form back into the mother in pill form. And so she's able to receive those doses of progesterone that effectively feeds the baby. So it is able to reverse what mifepristone intends to do, which is stopping the baby from receiving progesterone. It's a supplemental pill that adds that hormone back into the pregnancy cycle and is able to save a baby.
Okay, thank you.
Thank you, Dr. Lamb. Do we have any other questions for this sponsor of this panel? Senator Jackson.
Thank you, Madam Chair. What is the purpose of this bill and collecting the data?
So we brought in this bill to make it a women's health care data collection bill, which is why, and that was actually one of the changes to include across the board, and I want to make sure I get all the categories, prenatal care, birth, postpartum care, pregnancy care, abortion, menopausal care. And part of that is given the challenges and disparities with women's health care. If we have that type of information, that data, that should be used by policymakers and also in the interest of transparency to look at when you do have the disparities where funds should be spent and how that impacts policies. So and that's why, Senator, I specifically included the numbers on affecting African American women in my testimony.
So you support funding abortions?
So I personally do not support it. However, I also am aware of what's in Maryland's Constitution, which is why I have focused more on this does not restrict the right to abortion, which is in the Constitution. I have really focused this on the collection of data so that when we can see across the board, I found it very alarming, and which is why I included the numbers, affecting that, you have African American women more likely to die from pregnancy-related complications than white women, but we don't have data on that, and then across the board in those other areas. So yes, I believe that there should be transparency on not just abortion spending, but in all the other areas as well. I mean, for one, I tried to also focus in this testimony on prevention. I mean, if we're not spending enough money on prevention, which really has the long-term benefit, then maybe, we don't know that right now because we don't have the data.
Okay. All right. Thank you.
Thank you, Senator. I don't see any other questions. That ends the hearing on Senate Bill 485. Thank you, Senator Croza. Now we're going to go to Senate Bill 528.
Thank you, Madam Chair. Thank you, members.
Thank you. Senator Harris, Consumer Protection, Video Streaming Services, Loudness of Commercial Advertisements. Thank you, Senator.
There we go. I was just waiting for the mic. Great afternoon, Chair, Vice Chair. A Consumer Protection, Video Streaming Services, Loudness of Commercial Advertisement. This bill is about modernizing Maryland's consumer protection to reflect how families watch television today. More Maryland households than ever before are moving away from traditional cable and satellite television and towards ad-supported streaming platforms. Streaming is no longer the exception, it is the norm. Yet when Maryland families sit down to watch their favorite shows, they are often met with sudden increase in volume with commercials when commercial begins. These abrupt spikes are disruptive, frustrating, entirely preventable. Sudden spikes in commercial volumes are more than just an inconvenience. They can be particularly disruptive for young kids, startling for older adults, and uncomfortable or even distressing for individuals with hearing sensitivity or hearing-related disabilities. In 2010, Congress passed the Commercial Advertisement Loudness Mitigation Act, better known as the COMM Act. That law requires traditional broadcast, cable, and satellite television providers to ensure that commercials do not exceed the average volume of the programming that comes with it. The Federal Communications Commission enforced these standards. However, streaming platforms were not here when the COMM Act was enacted, and as a result, they fall outside its scope. That leaves Maryland consumers protected on cable television, but unprotected streaming services. The way we consume media has evolved, but our consumer protection laws have not kept pace. When two families are watching the same show, one through cable and one through a streaming service, only one is protected from the excessive loud commercial. That consistently does not make any sense for us. Consumer protection should not depend on the delivery method of content. In 2025, just last year, California passed Senate Bill 576, requiring streaming services to comply with the same audio standards applied to traditional television. And just yesterday, Virginia House passed unanimously the same bill. The measure received unanimous bipartisan support. Lawmakers recognize that updating consumer protection to reflect modern technology is not a partisan issue. It's a common sense one. Senate Bill 528 simply extends comparable protection to Maryland residents. It requires streaming platforms operating in our state to ensure that commercial advertisement maintain audio levels consistent with the programming they come with. It aligns with streaming services with existing broadcast standards. It closes a regulatory gap, and it modernized Maryland's consumer protection framework in a thoughtful and reasonable way. So as I close, at its core, this legislation is about protecting Maryland families in their homes. Sudden spikes in commercial volume are more than just inconvenience. They can particularly disrupt young kids, as we mentioned, startling older adults, and uncomfortable or even distressing for individuals with hearing sensitivity and hearing-related disabilities. We have already recognized through federal law that loud commercials are not acceptable on traditional television. It is only reasonable that those same protections extend to the platform that so many Mariner families now use every day. Senate Bill 528 does not create a new burden. It simply ensures consistency and accessibility and fairness across modern media services. As our technology evolves, so much our commitment to protect consumers, especially our most vulnerable population. For this reason, I respectfully urge the favorable report on Senate Bill 528.
Thank you, Senator. I have a question from Senator Jackson.
It's just a comment. I would say, Madam Chair, I thought something was wrong with my television when the volume would go loud. So to know that is actually done on purpose is very eye-opening for me. So thank you.
Senator Kramer.
Thank you, Madam Chair. Senator Harris, I just got a text message from my wife stating that she'll be watching my vote very closely on that floor. So I want to let you know I'm all in.
Bless your heart.
For the sponsor, we have Grayson Wiggins here, favorable with amendment.
Good afternoon, Madam Chair, members of the committee. Grayson Wiggins here on behalf of the Maryland Chamber of Commerce. We do have just a couple of amendments. As Senator Harris noted, California has passed a similar law. I believe Virginia has a bill or has recently passed a bill. And so our amendments would just align this bill with those bills. One, just clarifying no private right of action, which has been, I think, a regulatory framework consistent across the last couple of years of this committee that we've applied to other bills. And then just changing the definition of a video streaming service to match the definitions in the other states.
Surprise, surprise, no private right of action. Thank you for that amendment. And you actually submitted it in writing, Grayson?
We are going to submit the
Okay.
amendments in writing, yes, ma'am.
We'll
And
wait for that.
I've sent them to Senator Harris earlier today.
So Senator Harris, you're aware of that?
Yes.
Okay, thank you. Senator Kramer?
Madam Chair, Grayson, no private right of action. I think that we've been getting a strong signal from our Attorney General that private right of action is something our Attorney General wants to see in legislation like this because there seems to be a lack of enforcement, and private right of action provides a greater likelihood of the participation of the entities that are that this legislation is directed at. So I think maybe this committee's going to have a real conversation about an amendment that would strip private right of action. I mean, I understand the Chamber's position on this, but I think that what we're finding is that without private right of action, there's not a whole lot of enforcement happening, so.
I think to your statement / question, I guess you indicated applicability to the entities involved. And I think it's going to be far easier for an individual to file a complaint with the Attorney General's office, and the violation of this under the Maryland Consumer Protection Act is subject to $10,000 per violation. So it's not a small violation. I think that's going to be a much easier way and a better opportunity for them to address the issue than it is to go out and seek an attorney and then file a lawsuit, go through that entire process. So I don't know the Attorney General's opine on this bill, but I'd be curious to hear his thoughts on why he feels his office can't enforce it.
Thank you for that.
Thank you. Senator Washington?
Thank you, Madam Chair. Thank you for this bill. I wondered, what's the technology that allows them to be able to circumvent our TV's volume system to allow them to get so loud? And does this bill simply, outlaws that technology that allows it? Because I don't know how it happens, but it does happen. And I wonder, what is the technology that allows that to happen?
I'll have to follow up with you on that. I went to law school, so I didn't have to do math, and my guess is there's a lot of math involved in that technology. I'll follow up with you on what the difference is, but we're not in disagreement with the bill, to be very clear. We're just, trying to adjust it to fit the other states.
Yeah. I also wondered about the enforcement too. If I'm not recording it, but it still happens after this bill passes, if we don't have private rights of action or anything, how does one prove that this has occurred and hold that entity, that streaming service, accountable?
Yeah, I think that goes back to my earlier statement, which is I think it's going to be far easier for an individual to file a complaint with the Attorney General's office rather than having to go through the entire process of not only proving it, but also going and finding.
You said it would be easier to do that?
I think for the individual, yeah, I think it would be easier because I think the Attorney General's office is going to be better prepared to collectively address this issue than an individual having to try and prove it themselves, go and find a lawyer, secure that, go through the entire court process.
But in the meanwhile, my TV is still going loud. So if I'm going beyond that process.
Yeah,
right?
but I think what this does is it makes it a violation of the Maryland Consumer Protection Act, which has extensive penalties.
Okay, thank you, man. Appreciate it.
Good question, Senator. Thank you. Any other questions for Grayson or this witness? Okay, we have one person virtually, Ronza Othman from the National Federation of the Blind. Rhonda, can you unmute and present for us?
Yes, can you hear me, ma'am?
Yes, we can hear you.
Okay, great. Thank you so much. Madam Chair, Mr. Vice Chair, and members of the committee, my name is Ronza Othman, and I am the president of the National Federation of the Blind of Maryland. NFB of Maryland is the state's oldest and largest organization of and for blind, low vision, and deafblind individuals. We are extremely grateful for the senator for sponsoring this bill. I want to explain how most blind people and deafblind people access streaming services. We use technology that verbally reads the text that you visually see on your screen using synthesized speech. We navigate with the keyboard commands because we typically can't see the mouse pointer. We use a remote control like you do, left, right, up, down, etc. But what is on your visual screen is verbally spoken to us. We set our volume and settings so that we can engage with the page content, and we listen to the programming and also the text-to-speech to navigate and still hear the programming that is being streamed, so we can also hear our technology at the same time, saying pause, rewind, fast forward, and so on. But when the ads are louder than the programming, we're prevented from being able to interact with our assistive technology. We can't, for example, click the skip button with ads like others can do because the ads are so loud that we can't hear our assistive technology anymore. So we end up being a captive audience because the increased volume of the ads overtakes the tools we use to access the streaming services. Those of us who are deafblind have to change their technology volume and often miss the beginning of the programming while they try to adjust it back. This is more than annoying, it's discriminatory. For the reasons I shared here, as well as in my written testimony, we urge a favorable report. I'm happy to answer any questions you might have. Thanks so much.
Ronza, thank you for that. It was interesting to me to hear how you have to navigate the TV. I have enough trouble with my own pointer and controller, so I can't imagine how difficult it is for you. Do we have any other questions for Ronza? Okay, thank you very much for your testimony.
Thank you.
Thank you. Thank you. That ends the hearing on Senate Bill 528. My vice chair is going to take over, so I can.
Cool. All right, now here in Senate Bill 413, State Board of Morticians and Funeral Directors, Board Operations and Regulation of Cemeteries and Reduction Facilities. And we have a panel of one to sponsor the bill. Madam Chair.
Thank you. Thank you, Mr. Vice Chair. You all may remember we had a bill last year about crematories. It was really a big bill. It addressed a lot of other things in the law, but it was because there were some crematories that were not operating in good faith. You know, there were deceased bodies laying around in the crematory. So what this bill tries to address is to bring the crematories all under the State Board of Morticians and Funeral Directors and add an additional inspector so that they can more often inspect and investigate these crematories. What happens now is you have crematories that are standalone at Department of Labor, and then you have crematories that are with funeral homes that are in the Board of Morticians. And when we do any regulation change, it has to go to both places, and it has to be, you know, reviewed by both, and it becomes very complicated. So we're just simply trying to put this all under one place and add an additional inspector. So the bill makes a few changes, renaming the board to be the Board of Morticians, Funeral Directors, and Crematories, authorizing the governor to remove a board member for repeated and unexplained absences or just and reasonable cause, in addition to the current law authorization to remove for incompetence or misconduct, and establishes that a quorum of the board is a majority of the board members currently appointed, so the business can continue to take place even as vacancies on the board arise. Requires a simple majority vote for the board of directors. So for board action. So there's some opposition to the bill that's really based on current existing law. I didn't change other things that are in existing law, so that's a bill for another day. We're just trying to address crematories and the quorum on the board. So that's the bill. Thank you for hearing the bill, and I hopefully can have a favorable report from the Finance Committee on Senate Bill 413 with amendments.
Thank you, Madam Chair. Are there any questions? Seeing none, now we will hear from Charlotte Hoffman and Albert Bloomfield.
Thank you, Chair, Vice Chair, members of the committee. Charlotte Persephone Hoffman. I am the first Vice President of the Board of Morticians and Funeral Directors. Albert here is joining me. He is the second Vice President. He'll introduce himself in a moment. First off, thank you, Chair, for bringing this bill. We are going to have a number of proposed amendments that mostly Albert will get into. But we wanted to start by noting how crucial it is to update some of the provisions that we have in law at the moment. So currently, there are about 47 crematories operating in Maryland. 43 of them are licensed by the Board of Morticians and Funeral Directors, and 4 of them are licensed by the Department of Labor's Office of Cemetery Oversight. This has created some confusion about how investigations should be conducted, et cetera. This issue is only going to get worse as we move into the development of alkaline hydrolysis and natural organic reduction in the state, where we have 2 offices under 2 different departments trying to enact regulations to ensure that they're regulated the same way, and that we'll have 2 different sets of inspectors. So this bill would put all of that into the Board of Morticians, would ensure that there would be one entity overseeing all of these. In addition, it cleans up a lot of issues that we have with our current law. The chair mentioned the issue about quorum. For most of the past year, we had 6 members on our 11-member board, which means that for any action to happen, we had to have all 6 members there. No one could be absent, and in some cases, no one could abstain from individual votes. So there were things that went on for months without us being able to take action. Also, there are some tweaks in this that will facilitate our ability to complete investigations where violations of the Practice Act have occurred. So we do encourage that this bill be adopted, albeit with the amendments that were laid out in our writing, as well as some of those that Albert will discuss.
Hi, Albert Bloomfield. I'm a licensed funeral director and recently joined the board. I'm second vice chair. As Charlotte indicated, we are very much in favor of this, bringing it into one agency. We do have a few amendments that we're concerned about. One of them that stands out is that we are going to be asked for crematory and reduction facility operators to, when they register, to demonstrate financial stability. That for us is a very concerning issue. We are not accountants. The board is not really structured, staffed, or resourced for in-depth staffing needs. And we also feel like it would be an inappropriate thing for those things to be in front of the board. We also have concerns. There's talk about us being a mediator when there are complaints that we would have to mediate. Does not indicate, is that financial mediation? Is that, what type of mediation? Again, that feels something that the board is not really equipped to handle and to do. We talked about the crematory operators as well as reduction facility operators being able to do pre-need contracts. Again, that's very concerning to us. They are not licensed funeral directors or morticians where they would be able to follow those very strict laws that we have about pre-need contracts. I believe that's a carryover from OCO regarding cemetery contracts. So again, we very much like the bill and what it provides, but there's some cleanup that we feel has to be done. As well as the board changing its name. We already oversee the majority of crematories, and that's not in our name. We feel that that would be an undue expense on the state's behalf to have to change our name and all the things that will go along with that, seeing that that's something that we already oversee. Thank you.
Thank you for your testimony, Albert, and thanks for helping us. I think you've worked with Amber, and we're going to work on those amendments. Do I have any other questions? I have a question, Senator Hayes.
Yeah. So right now, there's the state morticians and funeral directors, which that board is over in the health department?
Yes. Yeah. Well, technically, we're overseen by the health department. We're not technically part of the health department.
And then there's the Office of Oversight was over in the Department of Labor.
Yeah, the Office of Cemetery Oversight is in the Department of Labor.
And is there any other death-related boards or commission? Because I remember last year when the incident happened with the cemeteries, it was heard by maybe the funeral directors, but then there was claim that they didn't necessarily have oversight of cemeteries.
Cemetery or crematory?
Crematories, I'm sorry.
Yeah. So those are the two major. There are other agencies that have some oversight role. So the Department of Health and the State Department of Health and the local departments of health have an interest in mortuary facilities, crematories, et cetera, in order to protect the public health more broadly. Other departments also have interests, such as the Department of the Environment. But these are the two primary organs of the state that regulate issues related to the industry of death.
Right, and I'm sorry, labor has oversight of cemeteries.
Cemeteries. And the way that this is broken down historically, because people are like, why do you have 43 and they have 4?
Right.
And the answer for that is when we started regulating crematories, the decision was made, and this was decades ago, that The crematories that were attached to cemeteries would be regulated by OCO. And the crematories that were attached to funeral homes or owned by licensed morticians would be licensed by the board. And so you had this situation where they ended up with a tiny little number, and we ended up with the vast bulk. And it's mostly worked, but there have been issues where there's uncertainty as to, if you're at the Department of Health, for instance, and you receive a call about, some crematory that has an issue, you don't know what the ownership structure of that crematory is. You can go look it up on our website or OCO's website, but that's going to add several steps to you, like reaching out to the regulatory authority. As to the situation that we had last year, unfortunately, I can't comment on the specifics of that because of the very specific rules we have in statute about our ability to make public comment on.
I'm good. I think I have enough information about that already. God, I lost my train of thought. But I guess the only other thing, last year, as a result of that, there was some legislation, I think it was a HGO or whatever, and part of the fixes on that was to bring on extra staff. Did that ever happen? Did that legislation make it all the way through?
It did not.
Okay.
Yeah, that was, I believe, HB 1555. Some of the elements of that have been wrapped into this. This also brings in the shift of the 4 OCO crematories to the Board of Morticians, and then by implication also brings into the Board of Morticians full regulation in the future of alkaline hydrolysis and natural organic reduction, which really is a potential issue for the future, where these are new industries that are developing in Maryland. Like we're in the process of having the regulations that we've drafted along with OCO approved. But as we need to, adjust those regulations as time goes on, as the industries develop, it will be so much easier for that to go through one agency rather than through us and OCO under the Department of Labor and us under the Department of Health. So this will really make it a lot easier for us to ensure that there's consistency in the development of these very crucial new processes that are coming online.
And the last question, since last year when several of the board members were dismissed, have all of the seats been filled as of yet?
We are currently filled.
Well, no, we're not.
Oh, wait, no, sorry.
So they were filled, and then we had a resignation of a consumer member who was the second vice president, and then we had an election. And so we're missing that. But I believe that position has been filled, but they haven't joined the board yet.
Gotcha. Okay, thank you so very much.
So he recently resigned, and I forgot.
That's
briefly.
okay.
Senator Ellis.
Yeah, thank you, Madam Chair, and thank you for your testimony. So the title of your state board is Morticians, Funeral Directors, Board Operations, the bill, and Reduction Facilities. So do we have any reduction facilities in Maryland yet? Because that's some new legislation we passed authorizing organic reductions a few years ago.
We do not have anyone currently doing the natural organic reduction, but we have somebody who has built a facility and I believe is waiting for the regulations to pass, and then they'll be operating.
Okay.
Or they'll be applying to us for the license.
They'll be applying, which again is part of the complication because the regs, we have 2 sets of regs, and who's going to oversee, there's the gap between this bill and if it passes with amendments October, and you have people who are waiting to, whether it be alkaline hydrolysis or NOR, that are waiting for.
NOR, what's NOR?
Excuse me, natural organic reduction.
Okay, great, thanks.
So
one second.
Oh, sorry.
So how long do you think before the regulation is written for the reduction facility to be operated? Because that's in your agency, right?
Well, it's currently at both Office of Cemetery Oversight as well as the board. We both have regulations that we have, I believe the alkaline hydrolysis were added to the crematory regs which have been submitted by both the OCO as well as ourselves. The natural organic reduction.
OCO has submitted theirs to the governor. We are in the process of finalizing ours. So it's the question largely at this point of how long the regulatory process takes on the back end.
Yeah, so what's your estimate in time?
By the end of the year.
Okay, all right, great, thank you. Thank you, Madam Chair.
Thank you very much. You can tell how complicated it's been when it's in two places. So, you know, I didn't try to do everything in this bill that 1555 did last year because it was a late file bill in the House. And so it was very late getting here, and it was just too much. So we're just trying to take a baby step here and give you all a little more guidance over the things that you need to be doing. So
Which we appreciate, and we would love an opportunity to meet with legislation to look at, you know, the issues and amendments that we're concerned about.
Yeah, so we'll take care of your amendments. Amber's going to work on those amendments with you, and then maybe next year we'll do the big bill that does more. But thank you very much for your testimony.
Thank you.
Thank you.
Next, we have two unfavorables. Walter Malloy, Maryland State Funeral Directors Association, and John Mitchell, Maryland State Funeral Directors Association.
Good afternoon, committee. Thank you for your time and attention to this matter. I am Jack Mitchell. I am a sixth-generation funeral director in Baltimore. I'm a past president of the Maryland State Funeral Directors Association and recently had the privilege of serving as the president of the National Funeral Directors Association. My family also owns Delaney Valley Memorial Gardens in Timonium, where we do have a crematory. So I have experience and knowledge in all facets of death care, which are affected by these regulations. And the Funeral Directors Association, generally speaking, we don't have an issue or in opposition to this bill. Its primary intent, we don't have issue with that. We're essentially neutral on that. But it is a 56-page bill. There are many parts to it, many provisions, and there are some that we do have issue with the language, some of which was, I think, kind of created from moving regulations from the cemetery crematory side over to the mortician side. And some of that, the two individuals that were just here spoke of those. And I think we're actually pretty well in agreement across the board as to what those issues are. But rather than amend, cross out, rewrite, change language, amend, we feel that for clarity's sake, for all of those who would be impacted by these regulations, whether it be the agencies that enforce them, the funeral homes, cemeteries, crematories who abide by them, or ultimately and most importantly, the consumers, the Maryland consumers who have lost loved ones, that for clarity's sake, that rather than, again, amend and change, to start with a clean slate and to have regulations that we would invite that you use us, pick our brains. We have the knowledge, we have the experience, we have the background. We'd be more than happy to help write regs that maximize clarity and thoroughness.
Thank you. Thank you for your offer. And Walter?
Yes.
Thank you. Are you testifying?
Yes, I am.
On top of your 20-page, no, your 14-page amendment with 20 issues. We do have it. It did come in.
Yes, I am. Thank you. Madam Chair, Vice Chair, esteemed members of the committee, my name is Walter Nathan Malloy, Jr. I'm the adjunct professor of mortuary law at Community College of Baltimore County. I'm a licensed mortician. My family owns March Funeral Homes, King Memorial Park, and Baltimore, Washington Crematory. I'm here on behalf of the Maryland State Funeral Directors as an attorney and lobbyist, and we have a lot of amendments that are concerns with the bill to the extent that we ask that you issue an unfavorable report. Respectfully, Madam Chair, this bill does a lot more than just move crematories to the Board of Morticians and give them an additional inspector. There were certain provisions added to this bill that were, as Mr. Mitchell said, copied and pasted into this bill from the business regulations that are inapplicable to morticians and funeral directors and even crematories. There are also issues in the bill that this committee and the drafters have the authority to change, specifically the definition of crematory. And the definition of crematory, this bill and other language in the statute includes reference that a facility that solely has alkaline hydrolysis can be called a crematory. And we argue and believe that this is not only confusing to the consumer, but it's also confusing to the professional and will cause problems in the future and could impose potential liability on an operator because of that confusion. There are portions in this bill that allow, as the board said, pre-need to be sold by operators of crematories. And in fact, the exact verbiage of the bill says crematories and reduction facilities can provide any goods and services, including any form of preservation and disposition that a mortician normally provides in the ordinary course of business. That is simply not true and needs to be removed. And there are other examples of where the copying and pasting has caused difficulty in the bill. We ask that you issue an unfavorable report. Thank you very much.
Thank you. We are going to work to clean up some of the copy and paste issues that happened, but it was not my intent to totally rewrite all of the regulation. It's in the current law. I didn't write new regulation or new law only to work on the crematory. So we'll work on the copy paste things. That's part of the issue with having crematories in one place and also, you know, with the Board of Morticians. It was just caused a lot of confusion. So,
and I'd be willing to assist in that. I'm available at any time.
well, thank you very much. Do I have any other questions for this panel?
Thank you.
That ends the hearing on Senate Bill 413. Thank you very much.
Thank you.
I was going to present Senate Bill 563, Health Facilities Confidentiality of Medical Records, Crisis Pregnancy Clinics. Senator Gall, you have Karen Nelson coming up with you and Gloria Toten. And I think, do you want Robin Elliott here too?
She can, sure.
Sure, Robin, you want to come up?
She wants, yeah, as well. Might
Maybe
as
she's
well,
not-
make it efficient.
Okay. I don't see her.
I don't see her either. Well, good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. For the record, Senator Dawn Guile, District 33, here to present Senate Bill 563. I'd like to begin by illustrating why this legislation is important in practical terms. Imagine a Maryland patient walks into a facility that appears to provide pregnancy-related services. She completes an intake form that includes information about her last menstrual period, pregnancy status, and whether she is considering terminating the pregnancy. She may also undergo an ultrasound. At a licensed medical clinic that bills insurance, that information would be subject to HIPAA. It could not be disclosed to a third party without the patient's written authorization. But if that same information is collected by an entity that is not a covered healthcare provider under HIPAA, for example, a facility that does not bill insurance or is not structured as a licensed medical practice, federal medical privacy law may not apply at all. In that circumstance, highly sensitive reproductive health information could be shared with a third party, including an organization or an individual who may contact the patient and encourage her to continue her pregnancy, without the patient having the same enforceable privacy protections she would have in a clinical setting. Crisis pregnancy centers exist in a gap between HIPAA and Maryland privacy law. That gap is what this bill addresses. Maryland has taken meaningful steps in recent years to protect reproductive health data. In 2023, we codified legally protected healthcare in our shielding laws. In 2024, we enacted the Maryland Online Data Privacy Act to strengthen protections for sensitive health information that falls outside the scope of HIPAA. Senate Bill 563 simply extends those protections to sensitive reproductive health information collected by crisis pregnancy centers. It does not create a new regulatory regime. It does not restrict speech. It does not target belief systems. It says one simple thing: if you collect personal medical information in Maryland, you must safeguard it. HIPAA does not automatically apply to every entity that collects medical information. It applies only to covered entities. If a center does not bill insurance, if it is not structured as a licensed medical provider, if it presents itself as a resource center rather than a clinic, then HIPAA may not apply at all. The result is the one that I just illustrated, that if a patient walks into what appears to be a licensed pregnancy clinic, completes an intake form, provides sensitive reproductive health information, she may have no enforceable legal right to control how that information is used and shared. When someone seeks help at a time of vulnerability, they deserve clarity and confidentiality, not ambiguity. Senate Bill 563 provides that clarity. I also want to note that we are, you may have seen in some of the written testimony that's provided, that we are working with stakeholders on amendments in response to some concerns that the bill as drafted could be read to identify or treat those centers as healthcare facilities. That's not the intent of the legislation, and we are committed to ensuring that the bill protects patient privacy without conferring that legitimacy. And for these reasons, I respectfully request a favorable report on Senate Bill 563.
Thank you, Senator. Karen, you want to go next?
Sure, happy to. Thanks. Good afternoon. I'm Karen Nelson. I'm the CEO of Planned Parenthood of Maryland. We're proud to serve over 40,000 Marylanders every year. In our healthcare centers, we provide care at the highest of the confidentiality levels. This is part of our value system. It is in accordance with all regulations, and it's why people come to see us. Unfortunately, the crisis pregnancy centers are not held to this same standard. These standards are not like other neighborhood community health centers, not offering health care at all. And on top of that, we find that there is a misleading of people who go to these centers. In fact, ACOG, the Center for Reproductive Rights, the American Medical Association Journal of Ethics, all have said that CPCs have provided inaccurate and biased information to minors and pregnant people. When we see this intentional misleading about people on their privacy, we see it through things like claiming on websites that they're required by law to keep health information protected or certify that they're HIPAA compliant. The reality is that these centers are just not protecting the information. We have evidence that Heartbeat International, the country's largest network of crisis pregnancy centers, suggests that individual crisis pregnancy centers incorporate language about HIPAA, even though they are not required to. Incorporate that language to give people the impression, and the importance there is the impression, that the centers must legally protect their medical privacy. I want to be clear, we're not supporting this legislation in an effort to do away with CPCs, because that is not what this bill does. But we are supporting it to ensure that Marylanders and patients are protected and their privacy is always protected. Thank you.
Thank you. Gloria, you next.
Thank you, Madam Chair and members of the committee. My name is Gloria Totten. I'm the president and founder of the Public Leadership Institute, which is a national network of state and local elected officials. We are a multi-issue policy organization, and I'm here in support of Senate Bill 563. As Senator Guile stated, when clients enter a crisis pregnancy center, they're given an intake form much like you might get at a doctor's office, except that it asks for much more information: sexual orientation, housing status, immigration status, how many sexual partners you've had, lots of other information. More than 80% of Maryland crisis pregnancy centers advertise ultrasounds, medical obstetric ultrasounds, which means that they are performing scans and collecting medical imaging data. Yet, as has been stated, unlike medical facilities, these centers fall into a blind spot under both HIPAA and existing state law, and this bill would simply close that loophole. Based on national averages, Maryland centers could be collecting the private health information of up to 10,000 women per year. Over time, that can mean that as many as 100,000 client records are already stored and vulnerable. This is not theoretical. Heartbeat International, one of the largest national crisis pregnancy center networks, promotes a centralized database called Next Level. It is designed to aggregate and track client information across centers, but it is not subject to the medical privacy protections that licensed providers must follow. This is very simple. Any entity that collects medical information or provides medical services should be required to protect that information under state law. Maryland has been a national leader in strengthening health privacy protections. Passing Senate Bill 563 simply ensures that those protections apply consistently and fairly to everyone who collects data. Thank you, and I respectfully urge a favorable report.
Thank you. So, Senator, would you like for Robin to come up and testify, and then we can
There
ask
she is.
questions?
Yeah,
There she is. She came up. Thank you, Robin.
Good afternoon. Robin Elliott here today on behalf of the Women's Law Center of Maryland and the American College of Nurse Midwives. First wanted to thank Senator Guile on her longstanding championship of data privacy issues. It's so important that we find and identify areas in which there are gaps in our privacy laws. And that is exactly what Senate Bill 563 seeks to do. These are entities that are not medical providers, so our traditional tools to make sure that healthcare information is protected, our laws do not apply. So Senate Bill 563 essentially seeks to extend protections as though these were medical records to the records of these entities. And with that, would appreciate support in working with Senator Guile and the other stakeholders on amendments just to kind of hone so that we're getting to the underlying purpose of the bill. Thanks so much.
Thank you. Do I have questions for our sponsor of this panel? No questions. Good job. Thank you very much.
Thank you.
And so that ends the hearing on Senate Bill 563. Our senator will stay at the table for Senate Bill 564. State Government Office of the Attorney General. David.
This will be quick. It's just me.
Just you.
Just little old me. Good afternoon. So, Madam Chair and members of the committee. For the record, again, Senator Dawn Guile, District 33, here to present Senate Bill 564. So, over the last couple of years, this body has taken meaningful steps to protect Marylanders' privacy, passing both the Maryland Online Data Privacy Protection Act in 2024 and the Maryland Kids Code to safeguard minors online. Those laws reflect our shared recognition that personal data protection is no longer optional in a digital economy, but passing strong laws is only the first step. Without the capacity to enforce them, even the most comprehensive privacy frameworks cannot deliver on their promise. And we have been talking in this committee, including today, about the concept of private right of action and about how we have historically in this committee removed that from a lot of our consumer protection related measures and other such bills and had the enforcement in the Office of the Attorney General. The Data Privacy Act that we passed and others have not had the private right of action, but instead had enforcement in the Office of the Attorney General. The issue is that the Office of the Attorney General doesn't necessarily have the resources in order to enforce. So this bill is about ensuring that the protections that we have enacted are implemented effectively and consistently. First, the bill creates a division of data protection within the Office of Attorney General to enforce Maryland's existing privacy laws, including the Maryland Online Data Privacy Act and Kids Code, by establishing dedicated subject matter expertise within the OAG. Second, it also establishes a one-year work group to evaluate how these laws are functioning in practice and to make recommendations for improvement. We are not alone in recognizing this need. California, although admittedly much, much bigger than Maryland, has gone furthest by establishing an entire independent agency, the California Privacy Protection Agency, dedicated solely to implementing and enforcing its consumer privacy laws. Most other states that have enacted comprehensive privacy statutes, and I believe when we passed data privacy in Maryland, 24 other states at the time had passed data privacy. Most of these other states have also taken a different approach by building out dedicated privacy enforcement units within their Attorney General's offices, effectively strengthening their consumer protection divisions with attorneys, technologists, investigators. These are complex issues, focused specifically on data privacy, compliance, and enforcement. States like Colorado, Connecticut, Virginia, and Oregon have all invested in specialized privacy teams within the AG's office to operationalize their new statutory frameworks. recognizing that privacy enforcement now requires technical fluency in data governance, algorithmic decision-making, and emerging AI-driven business practices. SB 564 adopts the same right-sized model for Maryland. It does not attempt to replicate California's independent agency structure, but it does ensure that we have dedicated in-house expertise to interpret, investigate, and enforce the laws we have already passed. I also want to acknowledge the fiscal reality of this year's budget. Creating a new enforcement capacity has costs associated with it, and it may not be that this year is the year in which we are able to fully stand up a new division. But I did want to bring the bill forward now because I do think this is an important conversation that we should be having. Similarly, I also recognize a committee and a work group in a campaign year presents its own logistical challenges, Madam Chair, I know, including for members who may be asked to serve. And it may also be that this work that I'm able to participate, I'm happy to participate moving forward, or it may be a discussion that is more appropriately taking up in a future year. But if we are going to enact the comprehensive privacy protections that we have put in place, including data privacy and Kids Code, we must think seriously about how these laws are enforced in practice. Otherwise, we risk creating statutory rights without meaningful remedies, basically nothing without teeth, when those rights are violated. And it's not to say that the Office of Attorney General is not enforcing anything, of course, but I think they need a little help. The work group established under this bill is intended as a forward-looking mechanism to bring together stakeholders, legislators, state agencies, consumer advocates, small businesses, and industry experts to assess compliance challenges, enforcement gaps, and emerging issues such as AI. Importantly, this bill does not create new substantive mandates. It ensures that the laws we have already passed are enforceable in practice, and it gives us the opportunity to study what appropriate enforcement structure should look like for Maryland moving forward. I know that the Office of Attorney General has offered some amendments, ultimately fine with those. And for these reasons, I respectfully request a favorable report on Senate Bill 564. Thank you.
Thank you very much for your testimony. I don't see any questions.
Thank you.
That was quick.
Thank you, Madam Chair.
Thank you. So that ends the hearing on 564, and now we're going to go to Senate Bill 569. Senator Ellis.
Madam Chair, I have a panelist.
I'm sorry, Senator, they weren't highlighted on my
sorry?
list. Your panelists weren't highlighted. I didn't know they were your panelists.
But are they on the list?
They're here. They're on the list.
Okay, wonderful.
We have a little system, and usually they're in bold, and I pick it right up, and they weren't bolded, so you're fine.
Okay, thank you. Good afternoon, Chair Vital, Vice Chair Hayes, and members of the Senate Finance Committee. Senator Arthur Ellis, representing District 28, Charles County. I'm here to present Senate Bill 0569, Commercial Law, Online Data Privacy, Limits on Data Collection. We're living in a digital economy where personal data is constantly being collected, analyzed, and monetized, often without individuals fully understanding the extent of that collection. This bill ensures that technological advancement does not come at the expense of personal freedoms. Senate Bill 0569 establishes clear limitations on how companies collect, process, and use precise geolocation data, particularly for targeted advertising purposes. Senate Bill 569, which will prohibit merchants, organizations, and any entity in possession of a consumer's sensitive data from collection or processing data outside of delivering a product or service without proper disclosure upon consent. The impact: by prohibiting the exploitation of consumer data, we can reduce the frequency of tragedies such as identity theft, invasive and harmful targeted ads, and the abuse of disclosures often marketed as necessary without clear description. The Maryland General Assembly has consistently demonstrated leadership in protecting consumers and safeguarding personal rights. If we can identify the root cause of exploitation in data breaches and the lack of online privacy protections, equally, we can be expedient in taking effective action. Therefore, colleagues, I challenge us to act, and I request a favorable report on Senate Bill 569. Thank you for your attention.
Thank you, Senator. So Jason or Nicholas, who would like to go next?
Great. Thank you, Chair Beidel, members of the committee, for the opportunity to speak with you and be here with you today. And thank you, Senator Ellis, for your sponsorship and leadership on SB 569. My name is Jason Knapp. I'm the Chief Legal and Privacy Officer of InMarket. InMarket is a digital advertising company, a small business that uses location data to help companies reach the right audience at the right time in the right place when they're making a purchase decision, including right here in Maryland. For example, here in Maryland, before ModPA went into effect, we partnered with over 65 grocery stores serving over 100,000 Marylanders across the state to deliver directly to shoppers' phone a digital version of the store's weekly advertisement circular with special offers and coupons. These ads delivered real-time, actual savings for Maryland's family, and this is now prohibited as ModPA currently stands. Unfortunately, ModPA overrides consumers' preferences in this space and prohibits the use of precise location data, even when a consumer knows how the data will be used and decides to affirmatively opt in, and even when it will save Maryland consumers actual money. This approach prevents a transparent agreement between Maryland consumers and Maryland businesses. And more broadly, we know digital advertising supports free or lower cost apps, websites, and news sources. Again, ModPA restricts affordability-based choices and actual cost savings for Maryland in how it is currently written. We urge you to support SB 569, which is a narrowly tailored bill that allows the use of precise location data only with clear consent from the consumer and when the clear notice of how the data will be used and clear consumer consent that is affirmative, that's express, that is recorded, and is a very robust process. And this preserves, of course, as always, the strong opt-out rights and delete rights that consumers have under ModPA. This bill does not modify those. Maryland can protect privacy without eliminating responsible consent-based advertising, and this bill is a balanced approach. So that especially allows smaller companies like ours to compete with larger big tech platforms. Thank you for your time.
Thank you. And
Hi. Good afternoon, committee members, and thank you for the opportunity to speak with you all today. My name is Nick Meyer. I serve as Privacy Counsel at the Network Advertising Initiative, also known as the NAI. The NAI was founded over 25 years ago and is the leading nonprofit self-regulatory trade association for advertising technology companies, promoting strong voluntary consumer privacy protections to sustain a free and open internet that maximizes data privacy and provides an environment safe for all users. On behalf of the NAI, I urge the committee to issue a favorable report for SB 569. We support this legislation because it will maintain strong nation-leading data protections for Maryland consumers, while also allowing for beneficial uses of consumers' location data, provided that the consumer gives their affirmative opt-in consent. As currently enacted, the Maryland Online Data Protection Act, also known as ModPA, effectively disables location services provided in mobile apps by third-party advertising technology companies, rendering most apps incapable of performing critical functions and cutting off essential revenue for app providers. This prohibition on the transfer of consumer location data targets mostly small and medium-sized app providers by threatening their ability to continue providing location-based services to Maryland residents, while continuing to allow these same types of location-based services from only the mobile operating platforms themselves and the largest tech companies. This outcome creates a substantial imbalance in the digital media industry, which will result in a severe disservice to Maryland consumers and the small business app marketplace. We recognize and agree on the need to protect consumers' sensitive data. We also believe if a Maryland resident receives clear, understandable information and chooses to opt in to receive relevant advertisements or offers, the law should not prevent that informed decision and the potential value from that exchange. For these reasons, we urge the committee to issue a favorable report for SB 569. Thank you for your time.
Thank you. Do I have any questions for this panel? Senator Guile.
Thank you, Madam Chair. Maybe Jason, just to be clear, the Maryland Online Data Privacy Act doesn't necessarily restrict geolocation data, right, or apps to use geolocation data. The concern here, and I think what you're trying to address, is that we treat precise geolocation, and so the committee is aware, this is tracking people within 1/3 of a mile. We treat that as inherently sensitive, true?
Yeah, that's true.
Okay.
Can I expand a little bit?
Sure.
Okay, great. Yeah, apps can use precise location data for the explicit purpose that a consumer asks the app to. So for example, if you're looking for driving directions, the app can find where you are to help you know how to get where you're going, the next move. But if that app is free and supported from advertising, then that sort of data cannot be used for, I presume, like my interpretation, cannot be used for secondary purposes like advertising or anything else besides what the narrow sliver of what the consumer asked the app to do.
But you can send them advertising for like a certain geolocation, like based on like, you know, zip code, for example, or a certain area. It's not to say you can't like advertise to them based on that. What you're wanting to do ultimately is to be able to track somebody within 1/3 of a mile of their specific location, assuming, I guess, is what you're trying to say, is that they opt in.
Yeah, if a consumer wants their more precise location data signals, which is in anything shy of more than 6 football fields lengthwise stacked together and made into a radius, so 12 as a diameter, anything in that very large space is considered more precise. So yes, if a consumer wishes to have their more precise location data signals to be used for advertising and for a benefit that they seek, then they should be permitted to do so.
We chatted a little bit earlier about this, and I understand you're talking about advertising, I think, to like grocery stores, but the retailers are opposed to this. I don't know if you've had a conversation, probably not maybe in the half hour since we've made you aware of this, but.
Yeah, I don't know if I've seen, I don't know if they're on the testimony list for today, but.
They are.
Great, well, I look forward to listening eagerly to their testimony, but have not had the chance to hear it and would love the chance to engage afterwards if possible.
Okay, and just as we've also have testimony in here from TechNet, a trade industry, they're also opposed to making this change.
Yeah,
Yes?
I look forward to hearing their testimony too, and would love to respond because from what I've seen, I think there's some clarification that the committee would benefit from.
All right, well, thank you. Thank you, Madam Chair.
Thank you for your testimony. And next, we're going to bring up Sarah Price from the Maryland Retailers Alliance.
Good afternoon, Madam Chair and honorable committee members. Sarah Price on behalf of the Maryland Retailers Alliance. It's true, we did not have an opportunity to engage with the members on the previous panel, and my understanding of the bill before us was that it would further restrict the ability to use geolocation data to advertise to customers. So perhaps we are each interpreting the proposal differently, but again, based on our understanding, we are opposed because the law as it exists already defines personal and sensitive data, and it includes the options for opting out of data collection and targeted advertising. And our concerns are that should a customer have to intentionally opt in, they wouldn't be able to get advertisements online for local events and sales. Local newspapers barely exist anymore. A lot of people no longer use cable TV, and so businesses have to try to meet customers where they are, which typically is on their phone. So the ability to geofence an area and advertise events, sales, and other things to the people in that area is very important for merchants these days. And again, should my understanding of the bill be correct, we have concerns that that would be restricted. But if I can be corrected, I would be happy to have that conversation. Thank you.
Thank you, Sarah. Senator Jackson?
Yes. Just looking at all the testimony, doesn't this bill help with consumer choice?
That's what I am now trying to figure out.
All right.
TBD.
Thanks.
Senator Ellis?
Thank you, Chair. So, Ms. Price, I'm curious, did you submit like written testimony?
We did not.
Okay.
But again, would be happy to discuss
I mean,
to
yeah,
make sure that we
it's hard-
understand it properly.
I'm sorry, could you say that again?
Sorry, just, we'd be happy to discuss it further if we did interpret the bill incorrectly.
Well, yeah, I'd love to look at the written word, you know, so I don't know if it's appropriate for me to ask why didn't you submit in a written test? So we can really analyze and see what it is. It's hard to really go back and, you know, watch the tape and understand what your concerns are, because we're really concerned about what your concerns are.
Right. We just had a lot of bills on our plate this week, and it was faster to sign up and testify orally than to prepare written comments in addition to everything else. But our understanding of the legislation was that it would add additional restrictions on being able to use targeted advertising. So if that is incorrect, again, we may change our position, but I would need to have that conversation first.
Could you, I don't know if you could still, you know, kind of send us some communication so we can look at it and to look at the bill and basically get back with you and hopefully say, well, we think your understanding of the legislation is not 100% where it is. Can you do that for us?
Sure.
Okay, thank you.
Yeah.
Thank you, Madam Chair.
Thank you, Senator. Senator Washington.
Thank you, Madam Chair. You know, I was trying to read the testimony too, and just trying to answer the questions before it was my turn to speak, and I wasn't able to get it. But you know, I do see it as a more of a consumer, giving consumers more options, right, of what they want to see, what they want, and it gives them the ability to opt in, right? And you guys, you represent the retailers, so all big, small, and this bill is about. It seems like this bill is about providing a more of a level playing field for the smaller businesses too, and the smaller tech companies as well. How do you guys decipher between big and small, and was that part of your opposition to the bill?
Generally, we look at every bill from the perspective that one-size-fits-all mandates don't exist, exactly because of the differences between large and small businesses. We were reading this through the lens of specifically being able to use like a geofence targeted advertising. So with thinking about small businesses in a main street or a small independent grocery store, if they want to advertise effectively to the people in their area, I would think that they would use, you know, a geofencing technology. Let's push out this sale to everyone within a mile radius, 2 miles, 5 miles. And so our concern, based on our understanding of the bill, was that they would not be able to do that unless a customer had intentionally opted in with that company. And so if you have merchants that are trying to reach people who are not already customers, you don't have that relationship already established for them to have done so.
Yeah. And this bill just allows for people to opt in. It doesn't require it, doesn't mandate it across the board. It just allows the consumer to opt in, or at any time, hopefully opt out too.
Right, yes,
Right.
yeah, opt-out is, and that was part of our concern, is that you already have the ability to opt out. Every website that you open has a cookies pop-up. Every new app that you download on your phone asks you how you want to, how do you want to handle your location data? And so we felt that that was already appropriate.
Got it. Okay. Thank you very much.
I don't see any other questions. Thank you, Sarah. Okay, so next we have our own Senator Jackson, Senate Bill 439, Employment Discrimination, Fire Rescue, Public Safety Employees, Use of Medical Cannabis. We did hear this bill last year. We're doing 439. We did hear this bill last year. We passed it out of the Senate, or out of committee, so we have two, we can have two. Oh, skip it? Oh, I'm sorry, 438, I missed it. I'm getting anxious, it's almost the end. I'm sorry. Commercial law, self-service storage facilities, Senator Carl Jackson is going to present. Daniel Bryant and Bruce Bariano are on the panel.
You ready, Madam Chair? You ready? Okay. Good afternoon, Chair Bidle, Vice Chair Hayes, and fellow members of the Senate Finance Committee. For the record, I am Senator Carl Jackson here to present Senate Bill 438, Commercial Law, Self-Service Storage Facilities Alterations. This legislation is intended to update and modernize the state's current Managed Self-Storage Act. The proposed language in Senate Bill 438 was worked on and agreed to in consultation with the Maryland Office of the Attorney General, Consumer Protection Division, and the Self-Storage Association. As a member of this committee, you should have received a copy of a letter of information from the Attorney General's office, an agreement that these changes met with their approval. The proposed changes to current law, which focus on procedures and communication between a self-storage company and the renter, are as follows. Number one, the self-storage agreements may be delivered and accepted electronically. This is settled law in Maryland, but the current language of the law does not make that clear. And number two, provides a process for handling property left in a rental unit following termination or non-renewal of a rental agreement by either the renter or the owner. This includes a 30-day time frame for a renter to remove their belongings, with a second notice required by the self-storage company at the 10th day mark before any property can be removed. These proposed changes in SB 438 are similar to those adopted in other states such as Delaware, Pennsylvania, Illinois, and you know it, California. I respectfully request a favorable report on SB 438. Thank you.
I'd like to go next. Daniel.
Madam Chair, Mr. Vice Chair, and members of the committee, my name is Daniel Bryant. I'm legal and legislative counsel to the National Self-Storage Association based in Alexandria, Virginia. Thank you very much for the opportunity to testify today. As for your support for Senate Bill 438, a bill meant to modernize the Self-Storage Act to provide a remedy when either the occupant or the owner elects not to renew a rental agreement and property is left behind. My written comments outline this process in a bit more detail. As the Senator just mentioned, this bill was negotiated and the language agreed upon with the Maryland Office of Attorney General. Thank you to Assistant Attorneys General Sakamoto Wangle and Stroud for their collaboration. Also, as the Senator mentioned, Delaware, California, Pennsylvania, Tennessee, Maine, and Illinois have substantively identical provisions currently in their respective storage acts. Additionally, the Virginia Senate just approved a substantively similar bill unanimously from committee and on the Senate floor. Therefore, I respectfully ask for your support for passage. Thank you again for the opportunity to testify, and I'd certainly be happy to answer any questions.
Good afternoon, Madam Chair and the committee members. For the record, Bruce Bariano, I would like to very much thank Senator Jackson and Senator Hershey, this bipartisan legislation. And I'm going to do something I've never done in this committee. I'm just going to say me too.
Wow. Thank you, Mr. Bariano. Do I have any questions for Daniel or Mr. Bariano or Senator Jackson? Yeah. Thank you, Senator.
Thank you, Madam Chair. I was just going to ask Bruce if he can repeat that.
For the record,
me too. That's good, Senator. That's good.
I don't see any questions at all, so thank you, Senator.
Thank you very
Bruce
much.
and Daniel.
Thank you very much.
All right, now we're going to do the last bill.
Okay.
Senate Bill 439. I started to say this bill passed this committee last year, so you can have 2 proponents and 2 opponents. And so we have Senator Jackson as the sponsor, Bradley Klukas and Grant Walker testifying in favor.
Okay. Good afternoon, Chair Bidle, Vice Chair Hayes, and fellow members of the Senate Finance Committee. For the record, I am Senator Carl Jackson here in favor of SB 439, Employment Discrimination, Fire and Rescue, Public Safety Employees, Use of Medical Cannabis. This bill will prohibit an employer of a fire and rescue personnel from disciplining or discharging an employee for the use of physician-approved medical cannabis. Our brave fire and rescue personnel risk their lives daily to protect our communities. It is imperative that we provide them with the access to the medical care they need, including physician-approved cannabis treatments, without fear of employment repercussions. Firefighters endure extreme physical and psychological stress due to the nature of their work. Many suffer from chronic pain, post-traumatic stress disorder, and other debilitating conditions resulting from the hazards they face in the line of duty. Traditional treatment options such as opioids and other prescription medications can have dangerous side effects, including dependency, cognitive impairment, and a reduced ability to function effectively. Medical cannabis has been recognized as a safer, viable alternative that would allow firefighters to manage their symptoms while maintaining their ability to perform at the highest level. Despite this proven medical benefit of cannabis, outdated employment policies continue to penalize firefighters who are unable to legally use it under a doctor's supervision. This contradiction between medical necessity and employment policies places firefighters in an untenable position, forcing them to choose between their health and their career. Such a choice is neither just nor in the best interest of public safety. It is important to remember that this bill will still allow employers to adopt policies or procedures that would prohibit firefighters from performing their duties while impaired by medical cannabis or any other drug for that matter. Protecting firefighters from unjust employment actions strengthen our emergency response system by ensuring that those who serve our communities are given access to medically necessary treatment options. For these reasons, I respectfully request a favorable report on SB 439.
Thank you. Who'd like to go next? Grant?
I'll go first. Thank you. Good afternoon, Chair Beidel and members of the Finance Committee. My name is Grant Walker. I serve as the president of the Prince George's County Professional Firefighters and Paramedics Association, IFF Local 1619, and the first district representative for the Professional Firefighters of Maryland, representing the members of Howard, Montgomery, Prince George's, Charles, Calvert, and St. Mary's counties. I'm here today to urge a favorable report on this legislation. I'd first like to thank this committee for their support on the bill last year in the legislative session. For over a decade, Maryland firefighter residents have had the right to access to medical cannabis. Yet the very people who run into burning buildings to protect our communities are being forced to choose between their careers and physician-prescribed treatment plans. To understand the stakes of this bill, you must understand the story of Jesse McCullough, a brother we lost to occupational cancer. His widow has testified in these chambers and shared the heartbreaking reality that during Jesse's grueling cancer treatments, he made the conscious, agonizing decision not to use medicinal cannabis. He didn't make that choice because it wasn't medically recommended. He made it out of fear. He feared that a positive test would result in the loss of his job, the loss of his health care while he was fighting for his life, and the loss of line-of-duty death benefits that his family so desperately needs now that he is gone. No firefighter should spend their final days choosing between pain relief and their family's financial survival. The fire service is a physical and psychological gauntlet. Our members face occupational cancer at a higher rate than the national population. In fact, it is the #1 reason that firefighters die in the line of duty. Chronic pain, anxiety, and PTSD are frequently tools of the trade. A byproduct of the grueling 24-hour cycles we work is sleep deprivation. The discrimination places an undue burden on not only our firefighters and our veteran populations, many whom have been transitioned from the military service to the fire service. The VA is currently prescribing cannabis for our veterans, and they're having to choose between treatment and their career. Howard County has taken a proactive step to address this. It's time that Maryland take a proactive step to address it statewide so that we don't have a piecemeal approach to this. I urge a favorable report on this bill. Thank you.
Thank you. Bradley?
Good afternoon, Madam Chair and other members of the Senate Finance Committee. My name is Brad Klukas. I'm an executive representative with Howard County Fire and Rescue Local 2000. Today, Marylanders have access to cannabis for both medical and recreational purposes with certain exemptions. Firefighters are appropriately classified as safety-sensitive employees. We are honored to be trusted in the most vulnerable moments of a person's life. We take the oath to protect life, and we remain steadfast in that commitment. But the job we love comes at a cost. Firefighters are far more likely to be diagnosed with certain cancers and face elevated risks of PTSD, chronic pain, and sleep disorders due to long shifts and repeated trauma exposure. I'm not here to say that the fire service is failing. I'm here to say that the men and women who willingly risk their lives for Marylanders should have access to the same lawful medical treatments available to those that they serve. Specifically, responsible off-duty medical cannabis use. One of the primary concerns raised is testing and impairment, and that concern deserves thoughtful discussion. Alcohol is the only substance for which we have a universally accepted biometric threshold directly tied to impairment. That standard does not exist for cannabis, nor does it exist for any other prescription medications that firefighters may legally use today. What we regulate in the fire service is not the presence of the substance, it's impairment and fitness for duty. We already have strong policies for reasonable suspicion, post-accident testing, and supervisor observation. Impairment can be evaluated through cognitive and performance-based assessments, and this technology continues to evolve. If anything, this legislation allows departments the opportunity to strengthen impairment-based protocols rather than relying solely on outdated metabolite testing that does not measure current impairment. Senate Bill 439 is about fairness and modernizing policy in a way that protects both public safety and firefighter health. Thank you for your time.
Thank you. Question, Senator Ellis?
Bless you.
Bless you.
Yeah, thank you, Madam Chair, and thank you for your testimony, your service. Quick question for you, Mr. Klukas. You mentioned that, is it the federal VA, Veterans Administration, prescribed medical cannabis?
Yes, sir.
Okay, how long have they been doing that?
So I can't specifically speak on the VA. I will tell you that the first fire department we know of in the United States that had a medicinal cannabis policy agreed to was Pittsburgh. They agreed to that roughly a decade ago. And the reason that it came about is because their veteran population were being prescribed cannabis for PTSD, pain management, number of ailments that had arisen from their service in the U.S. military. And so the union actually took a proactive approach to approach the county to work on a policy and a procedure involving medicinal cannabis so that these large amounts of military service members that were coming to work for our fire departments had the protection for their medicinal care, but also so that their fire departments were taking into account that they had a substance that could impair them at work, no different than they do with things like opiates or any other prescribed medication. And in fact, that model has been mirrored in Howard County recently.
Okay, I was just curious because as a veteran and knowing the federal government and it's still a really controlled substance that they're actually prescribing that.
So since you bring up the federal government, I think it is really important to note that the previous administration in the White House and the current administration in the White House have been marching down a pathway to reclassify cannabis from Schedule I to Schedule III. And in fact, the current administration within the last 6 weeks signed an executive order pushing the DEA and the government to reclassify cannabis from Schedule I to Schedule III without haste. The reality is that this is coming for this state no matter what. And the question becomes, are we going to wait for it to go in front of a court for someone to sue over discrimination, or are we going to take a proactive approach so that every fire department has the same level playing field with dealing with this, especially the ones that are in our rural counties and our communities that don't have large legal teams, that don't have the resources to develop these types of policies on their own? It's very important that we set this legal playing field across the state so that they're given guidance by this illustrious legislature.
So thanks for that. So if the feds are going in that direction, then I think, and they were the really strictest as far as we have pursued even recreational use. And so that'll be good news for folks in this category who needs the cannabis especially for medicine.
Yes, sir. I mean, that's what this bill does, is it gives firefighters access to medicine that they need for things like PTSD, injury and illness. The one that we didn't talk about today is that there's products that individuals are using that were legalized under the Farm Bill in 2018, CBD oil products that frequently show up in our outdated metabolite testing, and people are being disciplined for that. You know, we have taken in Maryland a very bury our head in the sand, pretend like this isn't something the legislature passed, over a decade ago. And the reality is that it's going to take the leadership out of this body to really set the standard and put everyone across the state on an even playing field so that everyone is protected in this realm.
Okay, well, thank you for your answer.
Thank you, sir.
Welcome. Thank you, Madam Chair.
Senator, I'm just curious about a couple things. Has Howard County had any incidences where someone tried to come to work and they were under the influence?
No.
Okay, that's
Not
good.
yet, ma'am.
And what's the testing? Because you can't do a breathalyzer or and the blood test would show it's in your system if it's been 2 weeks ago. So what's the testing? How can you tell that they're not under the influence?
So the way that works is with the supervisor observation. So the supervisor, anytime that somebody would get sent for testing, it would be more of a confirmatory reason anyhow. So in order to be identified as somebody who showed up to work under the influence, that is handled by the supervisor recognizing that. And in our county, you need a second supervisor in order to confirm that. So there's no issues with discrimination or things like that, or improper assessment. So when we go on a call, it is our job to routinely assess the patients and the people which we serve. And commonly, you're assessing, especially on a Friday or Saturday night, whether that person has the capability of making medical decisions on their own, or where we could legally essentially kidnap them at that point. So our capabilities of observing someone being under the influence is practiced every single time we go to work, and is a very good way to go about doing things, is to identify those are the people that we work with and are at the firehouse around us and have known us every third day of our life for a long time.
Grant, just remind me, it passed this committee last year. It passed the full Senate?
It passed the full Senate, yes.
And then it got stuck in the House?
Correct.
Is there a crossfile this year in the House?
There is a crossfile. Yes, it's Adrian Boafo's bill.
Great. Okay, thank you.
I do want to talk just a little bit about showing up impaired. The first portion of that question assumes bad action. I will tell you, as I'm the president of one of the largest locals in the state, and actually one of the largest locals in the country. And in my career, the last 15 years, I know of 2 individuals that have shown up intoxicated to work, and both were cries for help for underlying behavioral health issues that went untreated because they did not have access to the appropriate peer support, behavioral health treatments, and potentially cannabis for treating the underlying behavioral health problems. The reality is that firefighters are of high moral character. You put them through rigorous background checks, psychological evaluations, physical ability evaluations. They don't come to work to risk their jobs, to risk their second family that they come to work with, or the people that they serve. They swear an oath, and the fact of the matter is that our firefighters do not come to work intoxicated because they value the job that they do and the people that they're sworn to protect. But we already have policies in place to address those issues when they come to work. You know, 100 years ago, a lot of people that none of us knew made a cultural decision to target one specific medicinal product. And for 100 years, we watched as it was utilized as a political bludgeoning tool against different groups of people. And this legislature has taken a lot of steps forward to undo that damage that was done. The reality is that continuing these policies have a discriminatory effect across the board that have no real basis in safety, because there's not a single person, and I want to be very clear about this, there's not a single person in the state of Maryland that has ever tested positive for being high on cannabis, because drug testing cannot do that. And the reality is that these policies that are in place today are designed to regulate off-duty behavior and not workplace behavior, and it's just wrong.
Thank you, Grant. Senator Lamb has a question.
Yeah, thank you, Madam Chair. So currently, firefighters are allowed to use opioids, right, for medical conditions that they have, as long as they're not using it on the job or that it's impairing their ability to do their job, right? So this is just really trying to level the same playing field as opioids, as benzodiazepines, as it would be for cannabis, right?
That's correct.
Okay. And from an occupational health standpoint, I've done firefighter exams also for their annual physicals, that we also train supervisors oftentimes in being able to identify reasonable suspicion of impairment, right? There are actual trainings that are in some places mandatory, are available for supervisors to be able to identify reasonable suspicion of impairment, which is what this is intended to do, that like people can use it, they just can't be coming to the job impaired, right? And it's up to the supervisor, in this instance 2 supervisors, to be able to identify whether an individual is impaired or not. Just because they're using it off the job doesn't mean that they're coming to the job in their responsibilities on the job impaired to be able to do that. And if they are, then that triggers the reasonable suspicion kind of protocol for supervisors to identify that, and then further escalation from there.
Yeah, what we did in Howard County to ensure that people aren't coming to work under the influence, as Grant had mentioned, that's not something that firefighters do. It's in our culture to come to work ready to do our job. And so to protect those individuals who may make a mistake and accidentally take something within a certain time frame that was too close to when they came to work, part of our policy incorporates a 12-hour abstinence prior to coming to work. And the reason how we came up with 12 hours was the fact that it was, there's no clinical study that proved that it lasts, doesn't matter how much you take or what route or whatever, that it lasts longer than 8 hours. So we gave a 50% buffer on top of that to ensure, doubly sure, that somebody was not coming to work accidentally under the influence. And that has worked swimmingly for like Pittsburgh, who's had it for almost 10 years now.
Okay. Thank you.
Yes, sir. Thank you.
That was really good information. Thank you. I don't see any other questions for this panel. We do have two unfavorables, Sarah Sample from MACO and Robert Phillips, Maryland State Firefighters Association.
All right, thank you, the chair, members of the committee, for having me today. My name is Sarah Sample. I'm here on behalf of the Maryland Association of Counties. I'm also here on behalf of my colleague Carrington Anderson, who is sorry she couldn't be with you today. But we are here in respectful opposition to Senate Bill 439. I think one of the things with the language of the bill is that it is very clear that it is trying to thread a needle. It's definitely trying to protect the employee and the responsibilities of the employer, and we absolutely recognize that, and we appreciate the additional safeguards that are in there. The problem is that language can't address a few other concerns that we do have, two of which I'll bring up now. One is that we've already heard talked about as the ability to do real-time impairment testing. We don't have something that is widely accepted, but also legally standardized, and so that's a concern of ours, because something similar to a blood alcohol or breathalyzer type test stands up in court significantly differently than something that is a little bit more nuanced like this. The other thing I would point out is that we're concerned about the increased potential for cases and liability exposure, because there are two avenues for an action to be brought. One is obviously from the individual, but the other is the potential for the Maryland Commission on Civil Rights to also bring an action, which would, require us to respond, do an investigation, and defend the actions that were taken. The other thing I would do is just point to the fiscal note and say that I think that some of the concerns that I'm addressing here, we also see that the state has similar concerns there. And then the last thing I'll say, that anytime MACO is coming with concerns about additional liability exposure, it's not that this does look like it could be a narrow instance, but we don't necessarily know what the full potential is, and we're considering a lot of bills right now that have the potential for liability exposure, so we're not really able to consider this in a vacuum. So unfortunately, we do have to oppose Senate Bill 439. Thank you.
Thank you, Sarah. Senator Jackson has a question.
Yes.
Hi, how are you?
Good, how are you?
Have the counties faced any litigation for terminating medical cannabis patients under
That
current law?
I'm not sure, because this is Carrington's area, so I'd have to address that question to her.
I'm sorry, is who?
Carrington Anderson, who handles,
Oh.
so I'm here on behalf of her.
Okay. All right, thank you.
But so any litigation, for termination.
Senator Lamb.
Yeah, thank you, Madam Chair. To just pick up on one of the things that you talked about, that you mentioned kind of the legal implications of this for counties, and the potential burden on either counties or the Maryland Commission on Civil Rights. In your written testimony, you'd expressed a concern about the private right of action here. If we could figure out how to do this without that, would MACO be more comfortable with that?
If you could remove the private right of action for the individual, but leave the requirement for the MCCR? Or the potential for the MCCR? I think that's something that could be discussed.
Mm-hmm. Okay. I mean, the MCCR, I think, is also what's driving a line in the fiscal note, which to me seems a little bit extraordinary. I think it would seem odd to have to either bring on a new employee on the Civil Rights Commission just to adjudicate these kinds of things that may rarely ever rise to the Civil Rights Commission. I think most fire services will want to, and counties will want to behave in accordance with the law if this were passed. It seems a little bit hyperbolic that this would require a whole new person to be in the Maryland Civil Rights Commission just to be able to address these concerns. So, I think that's a bit of a stretch.
Oh, so I'm not necessarily saying that they need a new person in their office to be able to do this. I wouldn't know.
Yeah, I just don't think that many of these cases will rise to the Civil Rights Commission, and I know you don't write the fiscal note, and you're not the one that provided the input into that, but it just seems like a bit of a stretch. Was this a bill that MACo opposed last year?
I think we did end up opposing it last year, but I think it may have happened a little bit later.
Okay, so we didn't see the opposition here last year. You're saying the opposition may have arisen when the bill made it over the House?
I think so, yes. That's my understanding.
Okay. All right, thank you.
Thank you, Senator. I don't see any other questions. Thank you, Sarah.
Thank you.
That ends the hearing for the day. So we are going to give our manager maybe 5 minutes to get the system switched over. So come back in 5 minutes. Thank you.